I first heard about Volpara through members in the breast imaging industry. It's a fairly close-knit industry. I've heard about it for a little while and I've been keeping my eye on it, and when it became available, we onboarded it into our practices, and we've been very impressed with it ever since. Implementing Volpara density at our site at Mitcham for Imaging Associates has changed my clinical practice. I now report mammographic breast density as one of 4 categories from A through to D, and I also give a Volpara volumetric breast density percentage in my reports as well. I find that I give more thought to mammographic breast density, and we actually now offer a breast cancer risk assessment service, and we use the Volpara volumetric breast density as a part of that risk calculation. Since we've implemented Volpara at our practice, we've been involved in a few education sessions, mostly for GPs, to inform them firstly that we have the Volpara technology, but also what difference that's making to our reports and how it can help improve patient care. We've also been discussing Volpara with the specialists that we work with, mainly through our monthly multidisciplinary meetings for breast. This includes breast surgeons, oncologists and radiation oncologists, just letting them know not only that we have Volpara, but what difference it makes in our reporting and what difference it could make to patient care. With regards to GPs, most haven't heard of Volpara before, so they're hearing about it for the first time, but they're quite interested in it, and often after I've told them about what it is and how it can possibly change practice, they're often quite interested and quite keen to take it further. A lot of the specialists that I work with, in particular breast surgeons, have already heard of Volpara, but again, they're very interested and keen to know what difference it could make to their practice. Using the Volpara software in conjunction with our new breast cancer risk assessment service, we've been able to more accurately detect women that are at high risk of breast cancer and inform their referring doctors of this. And in conjunction with the referring doctors, we can facilitate a more personalised imaging screening program for them, which may help detect breast cancers at an earlier stage, which may then result in a better outcome. Image quality is very important in all aspects of radiology, but especially in mammography. Sometimes abnormalities on a mammogram can be very subtle, and if the image quality is not up to the best standard it could be, these abnormalities could potentially be missed, and that could potentially have an adverse outcome for the patient because it may result in later detection of breast cancer. I'm quite impressed with the VolparaEnterprise technology, with the large amount of information that it can give with regards to the mammographic factors that have been used, and that you can get that information in a variety of different ways. You can filter by period of time or filter by mammographer or site, and it can give you a lot of information about the technical aspects of mammogram. I'm not aware of any other software that can present that amount of information in such an easy to read format. Our experience with Volpara Technologies has been very good. It's been very easy to integrate into our existing system, and it's been able to give us lots of valuable information, not only with regards to mammographic breast density, but also with regards to the technical factors of the mammogram. The sales and onboarding process of integrating Volpara into our practice was very smooth and seamless. It felt like one day we didn't have the Volpara software and the next day it was integrated into our system. I was surprised at how smoothly it was able to be integrated. We had no major issues with that process.